Hi, I am Priya Prahalad, a clinical associate professor in pediatric endocrinology. My interests are in using technology to improve outcomes in children with type 1 diabetes. Type 1 diabetes is a lifelong autoimmune condition in which the body is unable to produce insulin, the hormone that lowers blood sugars. Children with type 1 diabetes have to take insulin. High blood sugars over the course of a lifetime can lead to long-term damage to the large and small blood vessels in the body. Tight glucose control has been shown to decrease the long-term effects of diabetes. A landmark study from 30 years ago called the Diabetes Control and Complications Trial showed that frequent blood glucose review and insulin dose adjustments by a diabetes provider can result in tight glucose control and decreased complications. However, these findings have not been implemented in practice. One of the biggest challenges to implementing this in practice has been the difficulty in sharing glucose data more often than at quarterly clinic visits. Newer diabetes technology called continuous glucose monitor, or CGM, which is a small wearable that measures glucoses every 5 minutes, can share data through the cloud. This allows diabetes providers to review the data and make insulin dose adjustments remotely. However, the time of a diabetes care team is constrained, which makes it challenging to scale these interventions for a large population of patients. The steps involved in routine data review are opening up the manufacturer portal, identifying a patient for review, reviewing the data, opening up the medical record, and sending a secure message to the patient. When we wanted to scale the data review to a larger population of patients, we worked with David Schenker and the Stanford Medicine team to develop an interactive tool to help identify patients who would benefit from data review. The tool called TIDE, or Time in Range for Diabetes Excellence, was developed in Tableau. TIDE can download a CSV file directly from the manufacturer's website, which contains the glucose data of the patients in our population. Using criteria based on consensus guidelines, the TIDE tool prioritizes patients and flags patients who would benefit from further intervention. Users of the tool can click into a patient and review the data directly from this tool before logging into the medical record to send secure messages. Here is a screenshot of what the tool looks like. In our use case, we have divided the population into 4 different groups, and we are able to identify which population we want to review from up top. In this middle panel, these are all of the patients who would benefit from data review ranked in priority of need. And in the bottom panel, we are seeing the data and clinical metrics for all of the patients in the population. We can select a specific patient and drill down and look at the glucose data for 2 weeks in this bottom panel. If we would like to see more specific data from this patient, we can go down even further and look at the individual daily views. With the use of the TIDE tool, providers end up reviewing about half of the patients in the population. On average, the provider saves 1 minute per patient reviewed. When translated to a clinical population of 1,000 patients, this can save on average 8 hours of review per review period. This tool has allowed our clinic to scale remote review to a larger number of our patients.